Kano State has one of the worst maternal indicators compared to other parts of the country.
Without using this contraceptive, I could have been in such a way that I cannot even present myself just like I am here.
In my own opinion, family planning is very important to the general populace in Nigeria, in Kano State, and globally, because it makes the mother to be more healthy. The baby that will be given birth to, it will be well taken care of. Both the mother and the child will have good health, and then the spacing between one child to another is another important issue in the life of both the mother and the child.
If you want to drastically reduce maternal death, it means we have to improve family planning. And that is why the state is opting for improving its family planning indicators and outcomes.
My neighbor then, in her 6 years, she gave birth to 5 children. And it was very, very terrible moment for her.
So da nake ji a gurin mutane magani nake aika mata zara haihuwa ma da zan daina haihuwa ko kuma kamar wani abu zai same ni.
We have many improvement since TCI came, and we are together always. We are meeting with that position structure I have set. It's an improvement. People now are coming to assess family planning in our various health facilities.
Wa'annan volunteers ne wa'anda suke ba mu gudunmuwa, suke ba wa al'ummar su gudunmuwa, ba wai akan al'amari irin wannan ba. Dukkanin al'amarin da ya shafi za a jawo hankali da wayar da kan mata, za mu tura su gudanar mana da wannan aikin.
In my society, if someone is trying to engage himself in having this contraceptive, they will just go against you, saying that what is the aim of getting married? You have to get married and you have to give many children as your husband need it.
Nayi kwanika na kuma yi. To akwai wata kungiya TCA ne, to su suka zo suka yi mobilizing dina a gida, sai suka kai na asibiti na je na karɓi wannan tazara, to shi yasa nake ganin amfanin sosai.
Za a samu taimakekeniya a tsakanin su waɗannan yaran kansu. Bayan lafiya da za ta wadata ga iyayen da su yaran, sannan kuma taimako ma zai iya shigowa. Domin in na sama yana da shekarun da ya bawa na ƙasa da yawa, zai iya taimaka masa a cikin mu'amalar rayuwa.
So for TCI, honestly, I will say they really, really helped Kano, especially in the aspect of family planning. I will say they've taken Kano to the next level.
Yeah, I think what is unique is the approach. There is full integration and commitment. And partners from TCI have distinguished themselves in the sense that they work as if they are also part of us.
Yeah, they support us with the advocacy learning skill. They give us much example, the way you look much healthier.
They usually help us in persuading the federal government to give us what we request for. And then in terms of the infrastructure, which is one of their greatest project, I will say, the 72-hour makeover that they do. It has helped us a lot to have a dedicated family planning unit in our facilities.
Community volunteers, people within communities are mobilized, sensitized to ensure that women of childbearing age are sensitized to come to the facility to access services, and that has yielded positive impact.
Before TCI, most interventions that we get from development partners is time bound, and they will just have it there, and once they leave, nothing to sustain. But for TCI, they have left behind a legacy.
We learned from TCI the importance of coming to meet the communities and coming to meet health workers in the facilities to spread the gospel of family planning services in the society.
all TCI activities, we've seen impact and we have adopted them into our annual operational plan, and we hope to keep rolling all this over the years.
The lessons we've learned through our partnership with the TCI, we've applied it severally, and for the future, we hope to apply more. Through our partnership, we were able to develop within a given year a concise, comprehensive operational plan.
Yanzu zan zo in zauna in kula da yaran sannan ni karan kaina ma ina jin daɗin yadda nake mu'amala da mai gida ma, so saboda ba kamar yadda nake yi kwanika a baya ba gaskiya.
Family planning is often seen as something that people don't want to talk about. You know, there are lots of cultural undertones, you know, around talking about family planning. But we've been able to see that in the states that we have partnered with, we have seen huge roles that religious leaders, community leaders have actually played, you know, in amplifying the voice for family planning and actually making a case for family planning. We've seen traditional leaders, very prominent traditional leaders, coming out openly to support and reinforce the need for family planning. We've seen very prominent religious leaders clustered into the interfaith groups coming out to actually champion family planning. And even in some locations, we've seen some of these interfaith groups spin off as independent organizations to talk about family planning as well as other areas. For us, this is a sign of success because it came as a result of us catalyzing the partnership through our business unusual model.
Most importantly, as individuals, I mean, Nigeria cannot attain its family planning goals without having more people embracing and using family planning. Nigeria, within this context, has a lot of people who are aware. There are still some who are sitting on the fence, and there are critical mass who actually intend to use, but they are not well stimulated to use. So the major gap is actually enabling and supporting those ones who already have desire to use. If we're able to do that, we would actually meet our goals.